Assalamu alaikum, dear students. Today I will explain the process of urine formation in excretion. Nephron. Nephron is a structural and functional unit of kidney, and it is microscopic, and millions of nephrons are present in a kidney. And look at the important parts of this nephron. So this is renal artery, artery that is supply the blood for kidney. So renal artery, and it branch and form afferent arteriole. That is important, afferent arteriole. And this part is known as Bowman's capsule. Bowman's capsule. And when the afferent arterioles enters into Bowman capsule and further divide to form a dense blood capillary network. So that dense blood capillary network that is known as glomerulus. And this part is known as afferent arteriole. Now this is Bowman's capsule, and after that this part that is known as proximal convoluted tubule, and this descending part that is descending limb, and this part that is known as loop of Henle, and this one ascending limb. This part is known as distal convoluted tubules, and finally it is attached with collecting duct. So many nephrons are attached with or finally give the filtered urine into the collecting duct. Okay, now let's go to the process of urine formation. So in this urine formation, there are three main steps. First one, ultrafiltration, selective reabsorption, and secretion. So you can look at the picture. So glomerular filtration, that is occurs in this part, glomerular filtration or ultrafiltration. And tubular reabsorption, that is occurs in this part, proximal convoluted tubule and a descending limb. And secretion that is happening in this part, distal convoluted tubule. And after that the urine that is collected in collecting duct. So what are the main process of urine? Ultrafiltration, reabsorption, and secretion. Okay, look at the first process of urine formation, that is ultrafiltration. So first you should know what is glomerulus. Glomerulus mean, so blood enters into the Bowman capsule through the afferent arteriole. So this afferent arterioles enters into Bowman's capsule and divide to form dense blood capillary network. So that is known as glomerulus. So ultrafiltration mean blood enters through the afferent arteriole, that is get filtered through the wall of glomerulus. How it is possible? We should know the diameter of afferent arteriole, that is higher than the diameter of efferent arteriole. So the blood which is contained in glomerulus has high blood pressure. So due to that high blood pressure, blood get filtered through the wall of glomerulus. And after that second filtration that happens through the Bowman's capsule. So ultrafiltration means blood gets filtered through through the wall of glomerulus and the inner wall of Bowman capsule. And finally, it's collected into the cavity of Bowman capsule. So this process is known as ultrafiltration. So after filtration, we call it as a glomerular filtrate. So it passes through the nephron. So look at this. This is glomerular filtrate. What is glomerular filtrate? Blood gets filtered, after filtration, ultrafiltration in wall of glomerulus and Bowman capsule. That after filtration, we call it as a glomerular filtrate. Blood gets filtered through the wall of glomerulus and the inner wall of Bowman capsule and collected into the cavity of Bowman capsule. This filtered fluid is known as glomerular filtrate. So you should remember, large molecules like plasma protein and blood cells are not filtered into the glomerular filtrate because these are large size particles. It cannot filtered by these wall of glomerulus and Bowman capsule. So this filtrate, that is same as blood plasma. Why it is same as blood plasma? Because when we can learn about the tissue, blood tissue, there are two parts, blood plasma and blood cells. So this filtered fluid, that is same as blood plasma, no blood cells in filtered filtrate. And what are the constituents of glomerular filtrate? Water, glucose, amino acids, vitamins, drugs, various ions, hormones, and urine. So look at the second process of urine formation, that is selective reabsorption. Now imagine when afferent arteriole brings the blood into glomerulus. First, it is filtered in glomerulus and second in Bowman's capsule, and glomerular filtrate passes through the nephron. So when the filtrate passes through the nephron or glomerular filtrate move along the nephron, most of the constituents reabsorb into the blood capillaries associated with nephron. So this process is known as selective reabsorption. So what are the constituents reabsorb again into the blood? 95% of water, 100% of glucose, minerals, urea, uric acid, amino acids, and vitamins, medicines. These are the constituents which reabsorb from glomerular filtrate to blood capillaries. So after the reabsorption that's happening in nephron, after the reabsorption, that filtrate change, the constituent of filtrate change, and that glomerular filtrate called it as a urine. After the reabsorption, the constituent of glomerular filtrate change. So in that time only we called it as that filtrate as urine. So urine is released into the collecting duct, and then it is into the pelvis. So the volume of glomerular filtrate formed during 1 minute. The volume of glomerular filtrate that is formed in 1 minute in healthy adults, adult is 120 milliliter. But 95% of the glomerular filtrate reabsorb when it is moved along the nephron. But you should remember, now 100% of glucose that is reabsorbed in healthy adult. If not, what will happen? The glucose may release with urine. So that time we can consider that person as a diabetic patient, because in diabetic patients glucose is not 100% of glucose reabsorbed into the blood. So we should remember, in a healthy adult 100% of glucose should be reabsorbed. So third process of urine formation that is known as secretion. Secretion that normally it's happening in a distal convoluted tubule. Some of the materials in blood capillaries associated with nephron enter the tubules of nephron again. This process is known as secretion. So what are the constituents that secreted into the nephron again? Hydrogen ions, potassium ions, ammonium ions, creatinine, drugs and vitamins. Removal of urine from the body. So urine released into the pelvis is transported along the ureters. I have explained about ureters, the important parts of urinary system, you know, pair of kidneys and pair of ureters, urinary bladder and urethra. So urine released into the pelvis is transported along the ureters into bladder and it is temporarily stored in bladder. So release of urine take place according to the need of urination. So what are the composition of urine in healthy person? Water about 96%, salts about 2%, urea about 2%, uric acid it is in trace, creatinine it is in trace. So now let's go to the diseases associated with urinary system. So first one, renal failure, weakening in urine filtration. So you know urine filtration that is happens in glomerulus and Bowman's capsule. So due to infections by microorganisms, heavy metal, mercury like arsenic, various medicine, carbon tetrachloride may be cause the renal failure. Symptoms of renal failure are edema. Edema means increase of blood pressure due to accumulation of salt and water. So you know when the urine filtration not happen properly, what will happen? The salt and water may accumulate inside the body. So it will cause blood pressure. And decrease of pH due to accumulation of urea. These are base. So what will happen? pH of blood that will decreases. So you should take, when these symptoms there, we should take immediate treatment by consulting a doctor. So if you not take the immediate treatment, it will cause acute renal failure in within 18 to 14 days. So then blood is, if the acute renal failure occurs, blood is filtered by machine. In that process is known as dialysis. So that is the one of the treatment for renal failure. But when both kidneys are failed, a healthy kidney from a donor should be transplanted. So that is the treatment for renal failure. Second one, nephritis, that means swelling of kidney. So it is occur due to the infections in ureters. You know that is the important part in urinary system. So due to infections in ureters and toxins, so it is affect the glomerulus and uriniferous tubules. So due to damage in glomerulus, volume of blood flow through it reduces. So amount of urine formed reduces. Waste material remaining is high in body because urine filtration that happens in glomerulus, so that is very important. So waste material remaining is high in body due to damage of glomerulus. Blood cells and protein also passed into the glomerular filtrate. Normally in healthy person we know glomerular filtrate it is same as blood plasma. Why? Because blood proteins, plasma proteins and blood cells are not filtered in by glomerulus and Bowman's capsule. So plasma protein and blood cells are absent in glomerular filtrate. But when the glomerulus get damaged, blood cells and protein also passed into the glomerular filtrate. So symptoms due to loss of proteins in filtration, stroke may occur. So the immediate medical treatment that is necessary to cure this condition. Third one, calculi in kidney and bladder. So that means crystallization of calcium oxalate in kidney and bladder will cause the calculi in kidney or bladder. So the symptoms, when stones block ureters, severe pain would occur. So the treatment for this disease, removal stones by drugs or surgery, and the stones can crushed by laser treatment, that is called as the therapy, lithotripsy technology. So the feeding habit of a person also reason for the stones, and postponing of urination is also reason for the about diseases. So you should maintain proper healthy lifestyle to prevent these diseases. So this is a normal kidney, and this is a big due to the nephritis, swelling of kidney or inflammation in kidney. So this is calculi. You can see stones in calyx, stones in pelvic area, right, and ureters, stone in ureters. Sometimes it formed in bladder, so it will cause severe pain during the urination. So these are the diseases associated with urinary system and urinary system. Okay, children, try to learn this process of excretion properly, and after that you can do the questions in your textbook. Thank you.